I love technology. The client has undergone an EGD, esophageal gastroduodenoscopy. The nurse places highest priority on which of the following items as part of the client's care plan. What is that, EGD? What do they do? It's a scope down the throat. How far does it go? Esophageal, gastro, duodenoscopy. They go right down into the duodenum. Okay. So, which of the following items it has the highest priority? Assessing for the return of gag reflex. Giving warm gargles for a sore throat. Monitoring the temperature. Monitoring complaints of heartburn. What do you think? A? It says number 1. Hey, assess for the return of the gag reflex. Makes sense, right? Because they compromised the gag reflex, putting that tube down there and basically holding the epiglottis open. Right? Let's try 5. I didn't mark it. Maybe it's... The nurse has taught the client about an upcoming endoscopic retrograde cholangiopancreatic procedure. The nurse is determined, we'll move on to a different one. He didn't even teach you guys about that, did he? Okay. Good? Let's talk about it real quick. They get that procedure. The nurse determines the client needs further instruction or information if the client makes the following statements. I know I must sign the consent form.
Put it down, we can't see it. There we go.
Oh, good, okay. They have my nails clean. We're looking for one that says that the client makes further information. And he says, I know I have to sign the consent form. I'm glad I don't have to lie still for this procedure. I'm glad some IV medication will be given to relax me. And I hope the throat spray keeps me from gagging. Are we awake during a cholangiopancreatography procedure?
No. I wouldn't want to be.
And the answer is, I'm glad I don't have to lie still for the procedure. So yeah, he would have to lie still. Sounds like they're going to be awake. A. The nurse performs which assessment technique first? Auscultation, inspection, palpation, percussion. Alright, good. 10. The nurse is caring for a client with a diagnosis of chronic gastritis. Oh, better. Okay. What is that? Chronic gastritis. Chronic inflammation of the stomach, basically. Right? The nurse monitors the client, knowing this client is at risk for which of the following vitamin deficiencies? Ooh. A, B12, C, or E? B12, right? Because they don't have that surfactant factor going on. We talked about that. I think we did. Nurse is reviewing the medication record of a client with acute gastritis. Which medication, if noted on the client's record, would the nurse question? Digoxin, indomethacin, furosemide, or propranolol? As acute gastritis, which one should they not take? Indomethacin. I don't know. I don't know what that drug is. Somebody look it up, don't tell us so we can find out what that is. 13. The nurse is monitoring a client with a diagnosis of peptic ulcer. Which assessment finding would most likely indicate the perforation of the ulcer? Bradycardia, numbness in the legs, nausea and vomiting, a rigid board-like abdomen. That sounds familiar. What do you think? Or, I forget, did Ron say, remember, rigid, board? 15, yeah, 4. Fifteen. Anybody find indomethacin yet?
Yeah.
It sounds familiar. Come on, what is it?
It's an NSAID for osteoarthritis, rheumatoid, but it says it can cause stomach or intestinal bleeding, which can be fatal. So it's probably why you went for it.
We were talking about acute gastritis. No, okay, because it kind of causes gastric bleeding. We don't want to have more. Right? Okay. All right, 15. A client with peptic ulcer disease is scheduled for a pyloroplasty. Oh, what is that? Pyloroplasty. Where is our pylorus? Do we have a pyloric valve? Yes, we do. Pyloroplasty. The client asks the nurse about the procedure. The nurse plans to respond knowing that a pyloroplasty involves cutting the vagus nerve, removing the distal portion of the stomach, removal of the ulcer and a large portion of the cells that produce hydrochloric acid, or incision and resuturing of the pylorus to relax the muscle, enlarging the opening from the stomach to the duodenum. Says 4, yay! Resuturing the pylorus, which is that valve. When you eat a whole bunch of food really fast, that pylorus just opens up so that your stomach doesn't get too full and burst. And if you need to relax it, rebuild it basically. Enlarge the opening from the stomach to the duodenum. You guys know about Bill Roth 2? I thought it was in the material. Move on to 18. Okay, the nurse is providing discharge instructions to a client following a gastrectomy. What is that? Ectomy means taking it out, right? Gastrectomy? Okay. Which measure will the nurse instruct the client to follow to assist in preventing dumping syndrome? Eat high carb foods, limit the fluids taken with each meal, ambulate following a meal, or sit in a high Fowler's position during meal. Now we're trying to prevent dumping syndrome, which is basically that pylorus opening up, right? How would we do that? 1, 2, 3, or 4? 2? 2, yes. Limit the fluids taken during the meal, because it would wash things right through, right? Okay. 19. The nurse is monitoring a client for early signs and symptoms of dumping syndrome. Which symptom indicates this occurrence? Abdominal cramping and pain, bradycardia and indigestion, sweating and pallor, double vision and chest pain. Somebody's showing me their index finger. I don't know. You think it's one?
Yeah.
19. Think again. Which other one is it?
3.
Who says 3? 3 is the right answer. A lot of dumping syndrome will do that, sweating and pallor. 20. The nurse is preparing a discharge teaching plan for the client who had an umbilical hernia repair. What is that? Umbilical is our belly button, right? Hernia repair. Which of the following would the nurse include in the plan? Restricting pain medicine. Maintaining bed rest. As a rule, after surgery, people should be getting up and moving, right? Avoiding coughing. Irrigating the drain. What do you think? 1, 2, 3, or 4? Who says 4?
3.
Who says 3? Yeah, 3. What is, well, you want to deep breathe and cough after surgery. What if you had a hernia? What if part of your intestines are sticking out through a weak spot in your abdomen? They put it back in, they suture it up. That suture is at risk for being compromised if you're coughing, right? I mean, we do want to deep breathe and cough, but gently. How would we prevent that? Who said splint? Yeah, I think you would do it with coughing, like splinting, because we do want them to do that, but you want them to control their cough, because you don't want them to re-injure it.
But that's not an avoiding of coughing, that's like careful coughing. Saying avoiding is just like, okay, let's like give you like anti-cough medicine.
I agree. So you guys know that we need to deep breathe and cough, we need to get up out of bed after surgery, but we also don't want to cause problems with that. And I think this is a bad question. So good, I'm glad you guys know that, that's the important part. 21, the nurse is instructing the client who had an inguinal hernia repair. Where is that? Like right at the bend of our leg, right? Inguinal hernia. Which of the following should, no, we're doing 21. How to reduce the postoperative swelling following a procedure. What should the nurse tell the patient to do? Apply heat to the abdomen. Elevate the scrotum. Limit oral fluids. Remain on a low fiber diet. All right, let me tell you something. I've lost count of the number of male patients I had who had swollen scrotums, like a basketball swollen. What do you suppose the best treatment is for that? Elevate that scrotum. And do you want it to be cold? And not so much. You want it to be cool? Let's say you want the. It's a little scary. There's 21. The answer is elevate the scrotum. So they were wondering how we could reduce postoperative swelling. Heat to the scrotum, is that going to reduce the swelling? No, that will increase it. Limit fluids? Not really, but kind of, I guess. You could limit fluids, yeah. Remain on a low fiber diet? No, yeah, I think elevate the scrotum makes sense. The nurse is caring for a client post-operatively following creation of a colostomy. Which of the following nursing diagnosis would the nurse include in the plan of care? 1, 2, 3, or 4, imbalanced nutrition, more than body requirements. 2, disturbed body image. 3, fear related to poor prognosis. And 4, sexual dysfunction. 2, who says 2? 2. Following a colostomy, disturbed body image. That sounds good to me. In fact, I have to tell you the story. My wife and I were out for a nice dinner, and we were sitting and talking tablecloths and silver, and we were talking, and I was looking at the couple next to the table, just kind of, talking to my wife, see the couple, and they're carrying on a conversation, and the guy reaches under the tablecloth. I might have been the only one who could see it. Opened up his colostomy bag, burped it, closed the colostomy bag, all while carrying on the conversation. I said, "That is so cool!" Because your bag will so I can build up gas. Bird to the bag, reclamped it while they were carrying on a conversation. Man, that's a success story ever I've seen.
That sounds a little bit unsanitized.
Totally.
It's like empty them and they're like.
Your stool is inside the bag. Your clamp should be clean when you put it back on. The outside of the bag should be clean when you put it back on. I don't remember. The guy probably got up and went to the bathroom a little while later. But it was so cool that he was so comfortable that he didn't even have to look at it. It was great. Nobody else in there noticed it. I might not have if I hadn't been a nurse.
I just can't get over this. How the heck do you elevate a scrotum?
You can actually, two towels, and I moist them like with water, and you put it over the leg and under the scrotum, and you can put like some tape on the ends of the towels and straighten it out, and that will elevate the scrotum. Tape the towel to the bed. Because
I can only think
if
of
it's
one
not
way to
higher
do it.
than the heart, you're gonna have a harder time breathing. How do we usually get rid of edema? How do we prevent edema in our legs? Why? Because the muscle action squeezes it back into the vascular system, right? How do you exercise your scrotum? You can't. You've got to do it with elevation or like cool packs. Have they got a picture of somebody elevating a scrotum?
Yeah.
Bring it down here. Put it on us.
One of them looks like a swimsuit from Borat.
Come on down. I mean, if you're comfortable doing it. It sounds educational to me.
Remember the lady we were talking with before, where she had that?
I'm not sure if this will work
I
or
was
not.
thinking, it's kind of it's like a sling that you put on.
Looking at.
So I think this one is the one we're looking at, right?
Like, put it around there,
Suspensory scrotal support.
Is
So I think that's for people that are up and moving around.
that a really oversized scrotum over there?
Yeah.
In the green?
Yeah.
Oh,
Green?
wow.
An animal scrotum or a person scrotum?
That's probably.
Wow, that may be bigger than the biggest scrotum I've seen.
Wow.
I've seen a scrotum bigger than that.
Have you? Wow, that had to be really cool. Thank you very much.
Oh, I see Borat stuff.
It's a good thing the skin stretches. Where were
Okay.
we? We elevated the scrotum, right? We're on 23. 23. Okay, the nurse is caring for a client post-operatively following creation of a colostomy. Oh, we just did that, distorted body image. Distorted body image is huge for somebody. In fact, I forget who said it, but some people literally don't want anything to do with it after their colostomy. It's so important for you to encourage them to deal with it. It's a poop hole just like everybody else has. It's just in a different spot on your body, and you have to have it. Sometimes it's reversible. They put one in so that they can allow the bowel to rest, and then it'll go away and hook it back up, and everything's fine. Sometimes they're permanent. I'm guessing the guy that had one that I was dining with there had a permanent one. But everybody poops one way or another. You have to reinforce to your patients. It's important for them to get familiar with it, to understand it. Oh, I'm sorry, I have a terrible story that goes with it. You want to hear it?
Yes.
All right. I had a patient. He was an inmate at the local prison, and he was very popular. He had a colostomy, and what he'd done is he had a tattoo of a lady.
Oh, no.
Yes.
Oh.
Tattoo of a lady, with the openings in the right place, yes. You just never know.
Are you serious? Wow.
So yeah, that guy had all the cigarettes he could use back when they were still allowed to smoke.
You gotta draw a line and not something.
Yeah.
I I know you're not judgmental, but you gotta judge
His
something.
biggest concern, he had paid good money for that tattoo, and his biggest concern was that we were gonna deface it.
Oh.
People, what do you do? Client post office. 23. We didn't have 24. The nurse is reviewing the record of a client with Crohn's disease. I forget, is Crohn's disease the entire gastrointestinal tract or just part of it? Which one is just part of it? Colon colitis, remember that. Just in the colon. Alright. Crohn's disease. Which of the following stool characteristics would the nurse expect to note documented in the client's record? Chronic constipation. Diarrhea. Constipation alternating with diarrhea. Stool constantly oozing from the rectum. 1, 2, 3, or 4? 3. We said 3? And who said 2? Crohn's disease, diarrhea. The lining of their intestinal tract is constantly irritated. Food is moving through too quickly. Double check. 24. Crohn's disease is characterized by non-bloody diarrhea of usually not more than 4 to 5 stools daily. Over time, the diarrhea episodes increase in frequency, duration, and severity. 1, 3, and 4 are not characteristic of Crohn's disease. We only have a couple minutes left. The nurse is performing a colostomy irrigation on a client. Was that done? Well, we haven't really done that yet, have we? Okay, we will. That'll be exciting. Anyway, during the irrigation, the client begins to complain of abdominal cramps. Which of the following is the most appropriate nursing action? Notify the physician. Increase the height of the irrigation. Stop the irrigation temporarily. Or medicate for pain and resume the irrigation. 3? 3? Who says 3? Stop the irrigation. I agree. It's probably 3. 3. If cramping occurs during the colostomy irrigation, the irrigation flow is stopped temporarily and the client is too rapid, or the client is allowed to rest. Good. Okay. One more. 26. The nurse is teaching a client how to perform a colostomy irrigation. Did we just do that? No. Yeah, teaching a client how to perform a colostomy irrigation. To enhance the effectiveness of the irrigation and fecal return, what measures should the nurse instruct the client to do? Increase fluid intake, reduce the amount of irrigation solution, perform the irrigation in the evening, or place heat on the abdomen. We want to enhance the effectiveness of the irrigation and fecal return. Who thinks it's 1? Who thinks it's 2? 3? Who doesn't have a clue? I agree, I think 1. This one. Yeah, 1. Enhance the effectiveness of the irrigation and fecal return. There are patients, in fact, old people tend to not want to drink water because they have to go to the bathroom. They tend to not want to go to the bathroom because they tend to fall. It's hard, it's painful, you might fall. So they drink less. Same thing with colostomies. People tend not to want to have to clean that colostomy bag and irrigate the colostomy. So they don't drink extra water. They don't eat as much. That's what you run into. I'm so glad we have this time together. Class is officially dismissed. 4 people that need to see me.